The topic of discussion that we are going to deal right now is we are going to talk about glomerular lesion associated with systemic disease, right? Under this topic, what we'll do is we'll just cover all these points from note, right? And then what we'll do is we'll just recap the concepts right here from our first aid. So without delay, let's move toward our discussion. Okay, now before getting into glomerular lesion associated with systemic disease, what I'd like to mention is what we are going to discuss. Okay, we have systemic disorders, right, where we have nephrotic syndrome as complication. We have systemic disorders where we have nephrotic syndrome as our complication. Now out of that systemic disorder, the thing that we are going to discuss is we are going to talk about what diabetes mellitus, right? We are going to talk about amyloidosis, right? We are going to talk about what SLE, right? Okay, now out of these three systemic disorder, the most common type of disorder which is associated with nephrotic syndrome is our diabetes mellitus only, right? Diabetes mellitus. So now without delay, let's move into our discussion. So talking about diabetes mellitus, right? Now what happens in the case of diabetes mellitus is, right, the patients who are suffering from diabetes mellitus, right, they have absolute or relative insulin deficiency, right? There will be insulin deficiency. Okay, let me mention right here. What will happen is initially there will be our insulin deficiency, right? Insulin deficiency. There will be our insulin deficiency, either absolute or relative insulin deficiency. Now because of this less amount of insulin, what will happen is that there will be increase in glucose concentration in our blood. Now patient will suffer from what? The patient will suffer from hyperglycemia, right? Okay. Hyperglycemia. Now extra amount of glucose. Now the extra amount of glucose now here will undergo non-enzymatic glycosylation. Now what is this non-enzymatic glycosylation, right? Now in okay, normally what will happen is that, right, normally for attachment of glucose to another molecule, we do require the presence of enzyme, right? Enzyme. But here in the case of hyperglycemia, right, in the case of hyperglycemia, what will happen is that, right, even without enzyme, glucose molecule can attach to different type of protein, right? And that the attachment of glucose with different type of protein, even without enzyme, that is what we call non-enzymatic glycosylation, right? There will be non-enzymatic glycosylation. Now because of this non-enzymatic glycosylation, what will happen is that there will be the development of or formation of our advanced glycation in products. What is this? AGE, right? Advanced glycation in product. Now this advanced glycation in product, where do they deposit? Initially they deposit in efferent arteriole. Okay, let me just, okay, what is this? Okay, this is our normal glomeruli, right? What we can see right here is, okay, what we have efferent arteriole, right? We have top capillaries, right? And we have efferent arterioles, as you can see, right? You can see parietal cells, you can see podocytes, visceral epithelium cells, right? You can see basement membrane. Okay, now here what I'm saying is, yes, there was formation of advanced glycation in product, and I have mentioned that this advanced glycation in product, they will go and deposit into our efferent arteriole, right? As there will be deposition of this our advanced glycation in product in efferent arteriole, what will happen? This will be narrower, right? As you can see, this is being narrower. As these efferent arteriole will be narrower, what will happen is that here in this tuft of capillaries, what will happen? There will be increase in pressure, because the blood can't flow properly, right? That's why there will be increase in pressure right here. As there will be increase in pressure, there will be increase in filtration pressure. This increase in filtration pressure, what it will do is, this increase in filtration pressure, what it will do is, it will cause hyperfiltration, right? What it will cause? It will cause hyperfiltration. Okay. Now because of this hyperfiltration, what will happen? That there will be deposition of lot of material within mesangial cell. As you can see, there will be deposition of a lot of cells in mesangial cells, and that will be by what? Extracellular matrix, right? Okay, because there was going on hyperfiltration. Now at the time of this hyperfiltration, what will happen is that this extracellular matrix, right, what they will do is they will cause deposition of they will cause deposition of a lot of material in mesangial cell, initially in mesangial cell, right? Now these deposition of material in this mesangial cell, as you can see, what we call this we call nodular glomerulosclerosis. right? Nodular glomerulosclerosis. Now we are saying nodular. Why? Because they are as what nodules, they appear as nodules, deposition of what material in a form of nodules. That is why we call nodular glomerulosclerosis, right? And these nodular glomerulosclerosis, okay, yes, we are telling that what there will be deposition of advanced glycation in product in our efferent arteriole that will cause hyperfiltration, and that give rise to what increased filtration injury, and that is causing nodular glomerulosclerosis, right? Okay, now this is also given another name, that is our Kimmel-Stein-Wilson lesion, right? Kimmel-Stein-Wilson lesion. Okay, now if this nodular glomerulosclerosis is not checked, then what will happen, that there will be the condition of diffuse glomerulosclerosis. That means these nodules, what they will do is they will just get diffused, right? And as they get diffused, these nodules, what will happen, there will be gradual decrease in our GFR, glomerular filtration rate, right? Okay, now yes, we got the brief idea about our diabetes mellitus, right? Okay, how it is causing nephrotic syndrome at its clinical manifestation. Now here, okay, as we have discussed in basic of this our renal pathology, that these are efferent arterioles, they are under the control of angiotensin, right? Now what these angiotensins do is, what they will do is they will cause efferent arterioles contraction, right? The contraction of efferent vessels. Okay, that means in order to these angiotensin are causing the contraction of this efferent arteriole, and here, because of narrowing of efferent arteriole, we are facing a lot of problem. So what we need to do is we need to block angiotensin, right, in order to widen this, in order to dilate this our efferent arteriole, so that more amount of blood will flow, and there will be no such complications. So what we do is, to treat such patient, we just provide angiotensin antagonist, right? And angiotensin antagonist, or we have ACE inhibitor, right? Angiotensin receptor blocker, right? ARB, or we can also give angiotensin converting enzyme inhibitor, right? Because they just dilate efferent arteriole, and that will reduce diabetic nephropathy. Okay, now one complication that we need to discuss right here is, right, because of hyperfiltration pressure, what will happen is that these are our renal pyramids, right? Renal papillae. Okay, now these deep portion of our renal papillae, what will happen is that they will get affected, they will get necrosed, right? And this is what we call renal papillary necrosis, right? Renal papillary necrosis on the tip of renal papillae. Okay, now the most common cause of renal papillary necrosis is our diabetes mellitus only, right, that we are discussing right now. But there are other things also, such as obstruction of urinary tract, sickle cell disease, and analgesics, such as analgesic, right? Analgesic, we have aspirin like drugs, right? They cause decrease in prostaglandins, right? Okay, and this can be remembered as DOSA, right? These are diabetes mellitus, obstruction of urinary tract, sickle cell disease, and analgesics, like that decreases prostaglandins. Okay, now yes, we talked about our diabetes mellitus, right? Okay, now let us move toward amyloidosis, right? Amyloidosis. Now talking about amyloidosis, what we need to know here is, right, kidney is one of the most preferred site for deposition of amyloid, right? Kidney is the most common site for deposition of amyloid, and especially talking about amyloid, we'll talk about secondary amyloidosis, right? Or the amyloidosis that is associated with chronic inflammatory conditions. Okay, now what will happen here is, right, kidney, as we have said that it is the most common site for deposition of amyloid, right? It is most severely affected organ because of amyloidosis, right? Now in kidney also, the main site where the first site where there will be the deposition of amyloid is our mesangial cells, right? Mesangial cells, and that is what the mesangial deposition, it is the first site to be affected. And now over the time there will be the complete glomerular deposition, right? Now, and eventually what will happen, as glomerular deposition will take place, right, the nephrotic syndrome will progress. And this is what this is about our what this is about our amyloidosis. Now moving toward our content of first aid, what we have is, let's go toward diabetes glomerulonephropathy, right? The most common cause of what ESRD in United States, right? Okay, now now here talking about another thing, okay, in diabetes mellitus, what will happen, there will be hyperglycemia, and there will be what non-enzymatic glycosylation of tissue protein, okay, that was what we called what what we are calling this non-enzymatic glycosylation glycosylation